I'm doing this is because I'd like us to move away from the idea that this condition is hormone balance. By the time I take one tablet here or the other, it will get better. Many women waste time and resources doing that, and it's frustrating doing that instead of trying to coming to their doctors to work out what is going on. So number one, hormone imbalance. Let's put it on our list. Okay. Number two, ovaries that are not functioning properly. Dysfunctional ovaries, for example, what you get with PCOS, that is polycystic ovarian syndrome. I've got a few videos on the channel on this topic, so please go and have a look if you don't know what it is. It can cause irregular bleeding. Sometimes it could be heavy bleeding. Sometimes it might be scanty, but dysfunctional ovaries, an example of which is PCOS, can cause that. Number three, uterine fibroids. Again, we have long list of several videos in the channel. Lovely playlist where I've curated so many different topics, questions around fibroids, what they are, treatments, what causes them, blah, blah, blah. Please go and have a look, okay? Number four now is endometriosis. Endometriosis is a condition that affects women. It's one where the tissues that happen inside the womb lining, tissues of the womb lining, appear in other parts of the body, most commonly in the ovaries or fallopian tube. Now, this condition can cause a lot of problems. It can cause heavy bleeding. It can cause painful periods, pelvic pain. We're not as good as we should be at diagnosing it in women. We're getting better because awareness and getting more and more about the condition. So we're getting better. But women with heavy menstrual bleeding, pelvic pain, painful periods, we must always think of endometriosis. So it's an important condition, okay? So number five is polyps. So a polyp is just simply tissue, extra tissue that's formed in a part of the body. Polyps can happen anywhere. You can have a tag, some part of a skin tag that's like a polyp. But happening within your womb or in the cervix, you can have a polyp and it can lead to extra heavy menstrual bleeding. I have just done a video on common conditions that you can find that affect the cervix, and I talked about cervical polyps. So please go and take a look at that one, just to understand the condition better. So we're now at five. Number six is adenomyosis. Now, that is something similar to endometriosis. Endometriosis, the womb lining is going outside the womb and traveling to other parts of the body, like fallopian tube or the ovary. In adenomyosis, the womb lining, the womb now is divided into different layers. You have the inside lining layer, then you have the muscle layer. So in adenomyosis, that lining that belongs within the inner part of the womb travels into the muscle, and that can also cause problems, amongst which are painful or heavy bleeding. So that's number six. Number seven, intrauterine contraception. For example, the copper coil, as just an example. Not in everyone, but it is a recognized cause of heavy menstrual bleeding. It might happen when you first have the coil fitted and then it settles down, but some women also have experience where the coil just causes them horrendous heavy bleeding until it's taken out. So that's another cause to be aware of. Next, we're going to look at number 8. You're looking at complications during pregnancy. So heavy menstrual bleeding can happen during pregnancy for one reason, for whatever reason. It is possible that the woman is experiencing heavy blood loss because she's pregnant. Then what about cancer? So we're now at number 9, reason number 9. Cervical cancer or womb cancer, if you separate them, we're now at number 10. So cervical cancer, womb cancer, those are also causes of heavy menstrual bleeding. They can cause irregular periods, irregular bleeding pattern, and sometimes there could be floods of blood loss, which is heavy menstrual bleeding. Next is bleeding disorders. Bleeding disorders, for example, conditions where people's platelets don't clot properly. And so that person is at risk of losing a lot of blood with very simple cuts, very simple injuries. They bleed a lot. Such individuals can also experience prolonged heavy bleeding coming from their periods. So that's another potential cause of heavy menstrual bleeding. Next, medications.